As of January 2nd, 2019, there have been 1,258 claims filed so far in the Federal Vaccine Injury Compensation Program for 82 deaths and 1,176 injuries that occurred after measles vaccination. Of that number, the U.S. Court of Claims administering the VICP has compensated 483 children and adults who have filed claims for measles vaccine injury. In this speech, I want to inform you about the cons of vaccinating. We will explore the history of vaccinations, look at the different conditions vaccinations can cause, and see the statistics of injuries and deaths relating to vaccinating. I don't know much about vaccinations myself, other than the ones I have had. However, I see and read a lot about them on a daily basis and believe it would be beneficial to do some research on. The first instance of vaccine promotion in the United States was in 1721 when Cotton Mather and Puritan minister encouraged smallpox vaccination in response to an outbreak. In 1796, Edward Jennings began with his successful use of cowpox material to create immunity to smallpox, quickly made the practice widespread. His method underwent medical and technological changes over the next 200 years and eventually resulted in the eradication of smallpox. The middle of the 20th century was an active time for vaccine research and development. Methods of growing viruses in the laboratory led to rapid discoveries and innovations, including the creation of vaccines for polio. Researchers targeted other common childhood diseases such as measles, mumps, and rubella. Vaccines for these diseases reduced the disease burden greatly. Measles immunization was becoming widely accepted in the United States in 1960. A formalin inactivated vaccine licensed in 1963 was withdrawn because it was induced short-lived immunity and pre-proposed recipients to an actively measles syndrome if they were exposed to the wild-type measles virus. Now that we've looked at the timeline for vaccinations, let's talk a bit about what they are known to cause. Today, vaccinating is a very controversial topic due to the studies of them causing SIDS and other major side effects. Since immunizations are given to about 90% of children less than a year of age and about 1,600 cases of SIDS occur each year, it would be expected statistically that every year about 50 cases of SIDS will occur within 24 hours of receiving the vaccine. The speculative vaccination autism connection decreased parental confidence in public health vaccination programs and created a public health crisis in England and questions about vaccine safety in North America. After about 10 years of controversy and investigation, Dr. Wakefield was found guilty of ethical, medical, and scientific misconduct in the publication of the autism paper. Additional studies showed that the data presented was fraud. The alleged autism vaccine correction is perhaps true, the most damaging medical hoax of the last 100 years. A total of 6,400,000 children developed the virus in the years 2000 to 2017, suggesting that there were an additional 491,000 paralyzed children above the numbers expected to develop the disease. Using data from the government of India showed potential vaccine, or PV, doubled the deaths of children soon after the vaccination compared to DPT. The author suggests that 7,020 to 8,190 deaths from PV each year in India. In my opinion, the fact that the peak of SIDS and death rates coincides with vaccinations is a bit unsettling. Most people will be surprised to know that there are not zero deaths caused by vaccinations. People do still get vaccine-preventable diseases in the United States. Tragically, people still do die from vaccine-preventable diseases as well in the United States from getting the vaccine itself. Millions of vaccines are given to children and adults in the United States each year. During the U.S. multi-state measles outbreak in 2014-2015, unsubstantiating claims of deaths caused by measles, mumps, and rubella vaccines began circulating the internet, promoting responses by public health officials to address common misinterpretations and misuses of vaccine safety surveillance, particularly around spontaneous reports submitted to the U.S. Vaccine Advisor Event Reporting System. Deaths associated with vaccine administration, but attributed to inappropriate handling, contamination, product error, or error of medical care. Vaccines, like any other pharmaceutical agent, are subject to mishandling that might, in extreme cases, lead to death. The Qatar incident is a well-known example of the vaccine contamination caused by errors in quality control by the manufacturer and lack of clear guidelines from a regulatory agency. 60 vaccine recipients and 89 contacts of recipients contacted polio as a result of contamination of 2 production pools of inactive polio vaccine with live viruses in 1955. Contamination can occur at more local level. Shokli, who is a doctor, reported several deaths following administration of measles vaccine in India. The report lists that caused the death of toxic shock syndrome and notes that contamination was likely because syringes and needles were reused and the sterilization procedures were unsatisfactory. To conclude, I encourage you to do some research to make more accurate assumptions and, furthermore, a decision. Today we learned about vaccinations. We took a look at the history, different conditions caused by vaccinating, and the reality of deaths followed by immunization. Opponents say that children's immune system can deal with most infections naturally, and that injecting questionable vaccine ingredients into a child may cause more side effects and even death. So is it really worth it?